How you doing, guys? So we got a special guest over from Trinidad, okay? So, and also happens to be a physical therapist. So Chloe said, what can I do to help you, sir?
So what's been happening is that I've been having pain in my lower back and in my lower hip, right hip as well. Yeah, also been having some pain in my neck and behind my shoulder blade on the right side, actually. Yeah. Some pain in my wrist as well.
Okay, what's going on the wrist, sir?
So what happens is that with constant use, what happens is that I feel like a little bit of tension right between here. It's a dull ache.
Mm-hmm.
Yeah. It's not, I don't get any tingling, I don't get any spasms or anything like that, but it's just got a dull ache that runs right in between.
Dull ache.
Yeah.
So we got a little mild carpal tunnel syndrome going on.
And possibly something like that going on. Yeah.
Okay.
Yeah.
All right, so let's take a closer look. See what's going on in terms of the hip pain, the low back and neck pain, and also that mild carpal tunnel syndrome you got going on there.
Right.
We're going to go based on, you're going to out right hip pain, correct? Low back pain, neck pain, and more importantly, right wrist pain. Let's point to the viewers here as well. What areas you feel again? You just feel tightness?
Yeah, so that comes straight down the middle here.
Okay.
Yeah.
Do you feel any weakness or any other, no other nerve issue, right? Do me a favor, can you put your fingers like this, very tight? Okay. Just resist. Feel that difference here? There's a little muscle weakness here.
Okay.
Okay. Go ahead, tight. Good. Relax. Okay. So that tells me, so usually what happens is the dermatomes, or we're mapping on the nerves. So since we found this a little weaker compared to your left one over here, this is traditionally the 7th cervical nerve root over here, and this is 6.
All right.
Tradition, okay? Now sometimes there could be some blending, so sometimes it's 5, 6, or 7, okay? And same story with everything else, okay? Because there's always some little variation going on. So we're gonna map out things on you, on the spine, see which one of these nerves is responsible for this weakness over here. Can also help explain what's going on over here.
Okay.
Now, when I take a look at these x-rays over here, even though it's tended to look over here first, I wanna look what's going on in the foundation first over here.
Yeah.
Now the overall spine, here's your left, but as everyone can see, it's tilted this way. Now, what makes this case a little interesting is the fact that usually when things tipping down this way, there's usually either going to be a PI, EX, or a PIX type of misalignment that can help explain for this, or an anatomic short leg. However, because of this line over here is shifted to the right, that means you're externally rotated twisted this way, when it really should be this way.
Right.
So your body did an opposite type. Usually when there's a combination, it's sort of like doing like a positive and negative, we want that kind of combination. Whereas it's the complete opposite. So this is what we call a PI-IN, right? That's not exactly a good combination we want to have. So other things also to show to the viewers and students, this is what I'm seeing here is a little bit taller here, shorter here. So the tall height over here confirms that's a posterior inferior type of misalignment of this hip bone. And this one is tilted shorter, anterior superior tilt of this ilium over here. And see that as well, okay? This one over here got wider and it's got shorter. So if it's shorter and blade-like, narrow, confirms, okay, external rotation. This one, internal rotation, okay? So we confirm we got a PI-IN over here. In addition to, just for kicks and giggles, we actually have an extra bone here, a 6th lumbar vertebrae on you, okay? Yeah! Now, this is what we call sacralization. That means this bone over here, while you're born, is trying to become part of the sacrum.
Yeah.
And in addition to this, also over here, we see this space over here. Just like you see space over here, we also see a space over here between the 6th and the sacrum over here. So this is, all intents and purposes, an actual 6th lumbar vertebrae. However, the transverse process, it's part of the sacrum, and also with the sacroiliac joints. So therefore, this 6th lumbar vertebrae, the 5, is supposed to rotate. Okay? But because we have these joints over there, it's going to limit rotation for the 6. So therefore, I won't be surprised, and that's what we find over here in the X-ray. Okay, this is inferior and wedged over here when it really should be like this.
Yeah.
So that's what we also have a little degeneration over here, and it's also narrowing down the tunnel over here because of nerves. It needs to come out of these tunnels over here, and yet instead it went like this and that way as such.
Yeah.
So that's what we see over here, all these tunnels, fine, and then start to get smaller, and even smaller. All right? So we're gonna map that out, see what's going on, what potential neuropons going on over there. Now, as a result of this twist over here, where your body was already immediately counteracting, okay, from here it's supposed to be going like this way. And then the rest of your lumbars did this immediate twist, and over here, a counter twist here, counter twist here, counter twist there, and twist over here. So that's why we started to see this fellow over here, okay, we start to degenerate, so DJD over here, and more importantly, right over here. So now we get to connect some dots, what's going on with your right hand, this disc over here, and that vertebrae, it went backwards, inferior was like this. Irritating that nerve, and that may help explain why this index finger here is getting a little weaker than it should. So we're going to confirm that examination on you. What's going on with this fellow over here? I'm going to take a look at his upper dorsal here, the mid back, okay? That fourth, well actually more like the fifth lumbar and the fourth lumbar. We'll double check these two. And also, I'm going to take a look, see what's going on with this left hip over here. So by adjusting this PI, what's going to do is it's going to re-level it. That's what we want to do. And the other sweet spot is the fact that this is almost a normal angle. So I'm going to take a look at it, see what's going on with that fellow over there.
All right, so what you're saying is that I dropped, rotated, and then you said there's a counter rotation that's going on.
Rotated this way.
Rotated, yeah, okay. And was there a counter rotation that was going on there as well, you said?
On the lumbars as well.
On the lumbar side, yeah.
Yeah, because the way your body was, it dropped that side and it went this way.
Yeah.
The problem is, we're not going to go this way. Your body, the lower lumbars immediately pivot.
Right. Yeah.
Counter rotate.
Counter rotate into.
Yeah. So that's what we're seeing, that immediate rotational shear going on down there.
Gotcha.
And that explains why you feel that low back pain all the way down there. So the real answer is, no, we're not going to try to like untwist in the middle of it. Like this over here, we don't want to just simply just go like, okay, let's go ahead and untwist this here. No, doesn't make more sense to work on the bottom part. That's the goal for you.
Gotcha. So like, if you would have left that untreated, you could have had some pain going down the leg at some point in time. Yeah.
Well, it could be pain, okay? But because those nerves are also connected to other organs, you may experience other organ dysfunction such as constipation, irritable bowel syndromes, or restless leg syndrome. It could be issues with prostate or infertility, so on and so forth. There's a long list of because whatever that nerve is connected to, that organ, whatever it is, that tissue, it's not going to work as well as it should.
Yeah.
All right, so first things first, we take a look at visualization. So there's swelling, muscle spasms here. And no surprise, there's also swelling. See? Even the sound, okay, because it's filled with adenomous fluid over here, it's going to have a different sound. So we're going to mark that level. Same story over here. So let's take a look, see what's going on. Take a look. With instrumentation, that's going to help confirm these potential areas that we want to take a closer look at during the examination. A little tender, right?
Yeah. So.
But nothing here.
Yeah.
See, that's what makes things interesting, because you were complaining about right hip pain. But what we're finding right now is, see, this is stuck. Your right hip, your left hip is not moving. The right hip, see, that's moving just fine. So basically what's going on is this, because your left hip was fixated, okay, it didn't move too well. Well, here's the thing, you still need to walk. And how are we going to walk? Well, your right leg has to move more to compensate for this fixated and stuck left hip. All right? So that's what the story is with that one.
That would explain the pain on your right hip, possibly.
Correct. It does, because it's now hypermobile. It's moving too much. So that's why you're experiencing that right hip pain. So that's why it's important we do a much more very thorough examination, determine the actual real root of the problem rather than dealing with the symptoms.
Sure.
Right?
Yeah.
How's that fella right there?
It's a little time not to touch actually.
Yeah, that's what I figured. How's that fella right there?
A little stiff.
Yeah, it is. Keep an eye on that one. Okay, right there. All right. A little more. Excellent. Okay, walk around, sir.
Yeah, it feels free.
I'm sorry, say again?
It feels free.
Feels free?
Yeah.
How's the right hip?
Yeah, that pain has actually gone down just a little bit, you know.
How much has gone down, sir?
Like about 2 notches. Yeah.
2 notches.
Yeah,
So
so
from,
it was like about a 3, like about 4, sorry, and then it's about 2 now. Yeah, I
okay,
can
so
still
we
feel a little
pretty much
bit.
cut it down in by
Yeah,
half.
yeah.
Yeah, that's good progress. There it is. Walk around, sir. Now what's different?
Yeah, that definitely feels good.
What feels good, sir?
Back feels good. The hip feels good.
Okay, so
Yeah.
how's the hip now, the right hip?
Yeah, so that doesn't hurt as much as it as I came in. It felt a little dull and achy. So that feels good right now. It feels looser, freer. Yeah.
Yeah, because we supply more nerve function from the 5th lumbar. We did not adjust your 6th lumbar. It's your 5th lumbar, okay? Supply more nerve function to that hip over there,
Right.
okay? So you reported a 50% improvement the previous adjustment.
Yeah.
How's it now?
Yeah, it's gone down. It just feels sore now.
Nice.
Yeah.
Okay, let's get the rest of your spine.
All right.
Good. My shoulders. There it is. Come on up, sir. Okay, walk around.
Yeah, that mid-back one definitely felt really, really, really tight. I felt like if my body wasn't really cooperating too much with that. Yeah. One up at the neck. Oof. Yeah, that feels good. That feels good.
How's your wrist, sir?
Yeah, well, so it wasn't really paining today. Feels fine. Feels fine right now. Yeah.
How's the tightness in the wrist?
Yeah, this feels free. This feels fine.
Okay,
Feels
so
loose
let's
right
do
now.
some more tests.
Yeah.
Okay, face towards me. Okay, so I'm seeing your lunate protruding more, sticking
Yeah.
out a lot more on your right. Yeah, it's stuck. Okay. Yeah. All right, let's see what's going on. So now that we cleared the nerve function from your neck into this wrist, now we get to work, see what's going on in here. So that's fine. Okay, so your lunate's out. So we're gonna set this bone. Pump it up first. There's that fella. Thumbs out too. Hold on. Relax. There's that magic.
You're gonna go with the whole thing, man.
Let's check this one here. This is slightly out. I'll set this lunate as well. A little more. Just a little smaller angle. There it is. Good. Fingers like this. Tight. Tell me, what's different now?
Yeah, it feels stronger.
How's this finger feels now?
Yeah, it does. It's not moving as it was before.
That's right. The strength are symmetrical. Yeah, that's why it's so important. We got to make sure your nerves are working just, very well for your neck over there.
Yeah,
All right.
yeah.
All right.
Gotcha. All right, doc.
All right, sir. Well, that's what it's all about.
All right, thank you.
You're very welcome. I'll see you next time.
Is that Trini Gonstead, man?